Hi, my name is Madili Das. As a business analyst, I extended my service in identifying business requirements for a software which will be used for telemedicine program. It's a health insurance system called Medigood that pays for a patient visit to the family doctor. It's a service that family doctor even get paid a bonus for using this service. This is done on telemedicine. To qualify for this service, patient needs to be fulfill certain requirements, it should be he or she should be more than over 65 years of age, and he or she should be indigenous and suffering from chronic diseases. A consultation can occur when a family doctor with a patient links up consultation with a medical specialist using a telephone or telehealth equipment. Medigood will make a payment to both of the family and the specialist. In this case, the family doctor or office administrator needs to identify a qualifying patient and then try to find a suitable medical specialist who is available, and he is to assign and monitor schedule appointment to see if they are qualified patients, and they try to schedule link with the specialist. Patients sometimes do not arrive on time at all. Doctors and specialists are often running late, and overall it is too difficult, especially for busy doctors. In this kind of situations, the service will be give the good services at this time. Some of the tasks I did progress here is by stakeholder analysis. It's an active means of identifying, prioritizing, and understanding a fundamental of stakeholders. Stakeholders are primary concern for each project. Project goal is to satisfy the needs of stakeholders, and stakeholders, some of the techniques used to identify are consult reference material, and questionnaire is to identify the stakeholders. Here, understanding the stakeholders can define by the roles rather than as complex and multifaceted individuals. Consist of patients, doctors, specialists, and as well as insurance company. The person who need the medical assistance, as well as a doctor and the telehealth specialist, and the insurance company, the Medigood. Main objects of this telehealth program are to expand the care to the greater distance by utilizing the telehealth equipments and delivering care to the population and suffering those who are suffering from chronic disease, to save the costs as well as unnecessary waiting at busy doctors. And the specialist log into the systems, and he gets a notification on online consultation regarding this all the services providing, and to the consultation, and overall he finish the consultation process. And the other method in the taskbar I have shown the product backlog. In this we have seen some of the user types and the story what the user and the doctor and the specialist are going through. That if doctor or the specialist, I want to have a dashboard so that I can see current appointments by date, and specialist, I want flexible to trigger a call from the dashboard so that the calling patient will become easy. And specialist gives a discussion call. As a specialist, I'm able to make a call directly from the app. It should be support video or the video chat, and registration has to be done. As a doctor, I want to have ability to register with the new patients. And in the next task we use cases. You have seen we have the two conditions, or this precondition and post conditions. In precondition, patient has approached family doctor, and in post conditions, appointments will be scheduled based on specialization. Specialist who is available online gets a notification online. It goes as normal flow. Patient visits the family doctor. Doctor diagnoses all the patients. Doctor verifies if patient qualifies for the telehealth. If it is yes, then doctor will be registered and schedule appointment from Medigood one if the patient is qualified. And when specialist receives appointments, in this precondition method, patient has qualified for the telehealth, and doctor schedule the appointment. Specialist is online. In another method is post condition. Special condition completes the consultation claim process will be initiated as a normal flow. Specialist gets notification of one of the appointment soon, or when the appointment is scheduled. It gives the update of availability of specialist, brief description about specialist updates, working hours, holidays, and leave details. Here the precondition method in this specialist should be a part of the Medigood, and in this post conditions, system should verify the availability before linking the specialist with the patient. As it flows normal for doctor log in to the Medigood, and then navigate to the calendar, and update working hours, holiday and leave details from the calendar. Verifies the claim status. Specialist and doctor able to verify current and recent claim status in such a way that in these pre-condition, post-conditions, the doctor and the specialist log into the Medigood and navigate to the claims again and until they verify current status and recent claim status. And some of the major advantages of these service decreases the hospital admissions and improves the management of chronic illnesses and reduce the healthcare costs, as well as we can improve the healthcare system. In this way, we have projecting, and these are all helpful. These are major advantages of these services. This is how this service is helpful to the clients, like patients, to reducing the illnesses, and as well as doctors to run their own the business. And in these I've given some of the references: a model for assessment of telemedicine applications, this from International Journal of Technology, and assessment in healthcare, Cambridge University Press 2012. These are the and in conclusion, I would say it could be beneficial to everybody in business strategies as well as to improve health services. Thank you.